this is me at my townhouse, not at the farm. And what's convenient about this, and why I've got both places, is because of my frequent hospital stays. I figure I may as well document it a bit better than what I have over the years. All anyone knows is, oh, Zoots has said she's had another operation. Another operation. Well, I've just had a large operation on my left breast because the ducts that nipples have, my ones get blocked. And since I was 19, well, since I've been 19, I've had so many operations. I probably can't document or explain it all, but over 20 operations into the one area to clear ducts rather than taking them away. The idea has always been to clear the site and get me on lots of antibiotics, pump my body up and get me and my skin to heal rather than taking them away, I guess, for the plan of whether or not I would have been breastfeeding or some other reason to keep nipples all healthy and safe. But luckily I've come across a surgeon who, through the public health system here in Australia, is basically doing it for free for me rather than it being an elective thing or a whole heap of other rigmarole. But the operation I just had 2 days ago now is about 2 centimetres wide and about 1 to 2 centimetres deep. So it's like a little crater, and I have to get the wound packed and dressed each day. Luckily, the hospital is just here. So that's my convenient little world at the moment. But let me tell you, I am in pain. This is like the game of Operation where you can't touch the sides. This particular wound is hurty. So if I'm a bit of a bitch or short in comments, there's probably a bit of preoccupation going on. Anyway, to have a recurring breast problem has been painful, has been an ongoing saga, and when my lumps come up, I tend to end up being treated through the emergency department. So it's not like a dermatologist sort of specialty area, or not a breast cancer area, not mastitis. It's a different problem. So for me to have suddenly come across a really, really thorough doctor or surgeon in my local area who has done more than just cleaning a wound site. She's gone in and she's actually taken more skin and made it more of a viable healing option. And in about a month's time, well, I've actually got a booked appointment, we'll be having a chat about me actually having ducts removed, which is a bigger operation. And I figure I probably do want to document a bit of this because it's not a typical kind of situation. It's probably not talked about very much. And yeah, I just want to share a bit of staying healthy, what treatment's like, how emotionally it goes, and it's just a good way to get to know me and my little world a bit more. So anyway, off I go to go and have them poke and prod me, and it's pretty scary because it does hurt. And yesterday the nurses held my hand whilst tears rolled down my face. So perhaps talking on here is also a little bit of a cathartic thing for me to go through maybe each morning for the next week whilst I'm having this done, or however many days that I'll be having the wound dressed and monitored. And it makes me feel a little bit more comfort in having, process, a program. Anyway, I'm now running 5 minutes late for my appointment because I'm doing this. I don't want to use the word anxiety, but I guess, yeah, there's natural apprehension, that's the one. Natural apprehension that comes through just because nobody wants to get hurt, even if it's meant to make you better. It's sore, poking at your boob, hurty. Anyway, I might go and buy myself a hot chocolate after this. We'll see. Talk to you later. Bye-bye.